let's start para makapahinga na rin kayo at makaaral pa kung gusto nyo pa mag-aral tonight. So, first is discuss the basic principles of pharmacology. So dito, gusto nating laging kino-compare your graded versus quanta dose response curve. So, tinatandaan ko dito are the concepts of efficacy and potency, tsaka yung concepts ng median effective dose versus your median toxic or your lethal dose. So basically, kapag sa boards, meron dong concept na from the name itself, malalaman mo na yung definition. Hindi ko na siya masyado minamemorize. Kasi kung makukuha ko naman na siya based din sa definition, hindi ko na siya kailangan pag-aksayan ng mas maraming brain cells. Kasi tandaan nyo, syempre, sa sobrang daming naaral nyo for boards, as you approach the last few subjects, talagang masasaturate kayo and feeling nyo na hindi na kaya kasi naubos na yung brain cells nyo. So might as well, itipid nyo siya para dun sa kailangan nyo lang, yun lang yung memorize nyo. So for this one, graded, sa graded dose response curve, you're talking about efficacy versus potency. Efficacy, obvious naman yan, the maximal effect. Ang gusto ko na emphasize siguro yung potency. When you say potency, it's a measure or concentration of the drug wherein half of the maximal effect is achieved. So half of the maximal. Dok, paano madaling tandaan? Our label is 50. That's half. Ibig sabihin nito, it is the concentration, hence C, concentration at which 50% of the effect, letter E, is achieved. And then your median effective dose, which you obtain from your quantal dose response curve, it is the dose, letter D, wherein 50% respond sa population. So may effects of 50%. Then your median toxic or lethal dose, it is the dose, letter D, wherein 50% or half, same pa din, half toxicity or lethality or death. Okay? So, define siya based dun sa code or dun sa name mismo ng concept. So, yung mnemonic ko dito is your AB. So, naturo ko to nung mga nag-face-to-face, no? So, nalaman nyo naman doon, according talaga ako mag-mnemonic. Pero up to you again, up to you guys, kung gagamitin nyo, basta kung anong makakabuti sa inyo. So, ang sikip if farin. Papalit daw tayo ng van. So, again, when I make mnemonics, tinatry ko na kung ano yung mnemonic, nandun siya sa, nandun yung hinahanap. Kasi, hindi ko matatandaan eh. Mangyayari, alam ko lang yung mnemonic, hindi ko alam kung para saan siya. Okay, so, para madaling tandaan, ang sikip kasi narrow therapeutic index. Again, ang sikip kasi narrow therapeutic index. So, ito yung drugs. So, for this, we don't have the luxury of time, so I want you to memorize. But, apart from memorizing, I want you to always define the class. Again, bare minimum natin for the board exams to know at least the class of drugs. Okay, the class of the drugs. So, amphotericin B, yan, it's an anti-fungal, diba? So, amphotericin B is an anti-fungal. Your aminoglycosides is a antibiotic. Your carbamazepine, your phenobarbital, and phenytoin are anticonvulsants. So, when you memorize your drugs, you can also classify based on class. So, carbamazepine, phenobarbital, and phenytoin. So, alam nyo na, may tatlong anticonvulsants na may narrow therapeutic index. Ano pa? So, warfarin is an anticoagulant, your lithium, drug for bipolar, digoxin is a cardiac glycoside for your heart failure, and then your theophylline is a PD inhibitor for your asthma, COPD, so it's a bronchodilator. And then your vancomycin, again, is an antibiotic, as with your aminoglycoside. So, tandaan, may dalawang antibiotic na may narrow therapeutic index. So, again, remember this mnemonic. So, we have naman your first versus your zero order elimination. Pag tinuturo ko to sa students, ano lang gusto kong tandaan nyo? Pag first order, we eliminate a constant ano? Proportion. First order, constant proportion. Zero order, we eliminate a constant amount. Okay? We eliminate a constant amount. So, ibig sabihin natin doon, kung dito, constant proportion tayo, tapos dito, we eliminate a constant amount, ibig sabihin, no matter what happens, dito sa zero order, 2.5 lang tatanggalin ko as an example in this figure. So, kahit pa nag-start tayo ng 10, next natin is 7.5. Tapos minus 2.5 is 5. Minus 2.5, 2.5. So, same amount yung tinatanggal hanggang sa maging 0. Then, si first order, nag-start tayo ng 10. Kunyari, para maging half, kunyari. 10, half ng 10 is 5. Half ng 5, 2.5. Half ng 2.5, galing nyo naman mag-math. So, 1.25. Half ng 1.25 is 0.6125. And so on. So, ibig sabihin, hindi to point. Ayan. And so on. So, ibig sabihin, in first order, you don't reach 0. Tignan nyo. It continues up to, it is continuous na magiging exponentially nagde-decrease. So, pag ganyan siya. Well, your zero order reaches 0. Kaya siya tinawag na zero order. So, it reaches 0. 0. 0 order. It's a line. Why line? Yung slope niya, yung constant amount na tinatanggal mo, which is here, 2.5. First order, exponential decrease kasi proportion ng tinatanggal mo. Kalahati parate eh. Okay? So therefore, the elimination rate in your first order is proportionate to the concentration. Dito, the elimination rate is always constant kasi same amount yung tinatanggal mo. Okay? So with that, our mnemonic is what pet. So tall what pet ang walang order. So aso. So what walang order kasi zero order. So there's a zero order kinetics are the following. So your what pet. Warfarin, heparin or anticoagulants, aspirins and antiplatelet. Tolbutamide is a sulfonylurea, di ba, for diabetes. Phenytoin, anticonvulsant ethanol, an alcohol, then theophylline, a bronchodilator. Remember this mnemonic. Another mnemonic. So, ito, nice. 9 nice, continuous drugs and meds have less effects. So, ito medyo mahirap tandaan yung mnemonic. Pero kung desperado na rin kayo, gaya ko nung nag-aaral ng boards, pa din siya gamitin. So, less effect kasi tachyphylaxis. If you remember, what is tachyphylaxis? Tachyphylaxis with continuous exposure, continuous use of the drug, nagde-decrease yung effect at a short term. Tandaan nyo, short term. Pag long term, sabihin, ginamit mo ng isang dekada mo nang ininom yung gamot. Nitrates ka isang dekada. Nagka-tolerance ka. So, with long-term use, that's your tolerance. Again, tachyphylaxis, short-term use, tolerance, long-term use. Para sila ng gradual response to the drug. Gradual decrease in response to the drug. Okay, so this is your mnemonic. Then next natin, so, okay, sorry. This is the continuation pala of my mnemonic. So, yung 9 nice, continuous drugs and meds, so MED, have less effects. Pero ang tatanungin niya ako, Doc, high yield ba? Actually, hindi. Hindi siya masyado tinatanong. Pero kung mayroon nang kayong tatandaan na kung mani nagpe-present with tachyphylaxis, tandaan nyo at least it's dobutamine. So, dobutamine commonly presents with tachyphylaxis. So, phases of clinical trials, di ba complicated yung figure, dami sinasabi. Pero in general, pag phase 1, unang-unang mo gusto malaman sa gamot, okay ba to? Safe ba to? So, safety, less than 100 subjects. Phase 2, effective ba to? Kasi alam mo na kung safe eh. So, next is to know na effective siya. So, that's in more. So, more than 100 or less than 1,000. Then, pag alam mo na safe daw siya, effective siya, phase 3, therefore, is your safety and efficacy. So, that's your more than 1,000. Then, your last phase, your post-marketing surveillance, yan yung sinabak mo na sa tens of thousands or hundreds of thousands na tao kasi alam mo na na safe at effective. So again, safety, efficacy, post-marketing. This is also applicable for your PrevMed pag lumabas. Then for your common teratogen, so ito ang dami, no? Since summary lecture to, niread na natin yung important. Remember, ACE inhibitors can cause fetal renal damage or fetal genesis in your second to third trimester. So again, ACE and ARBs to. Okay? ACE and ARBs, also your angiotensin receptor blockers. Ano pa bang gusto ko emphasize? Your lithium causes your Epstein anomaly. Okay? Your isotret causes your craniofacial malformations. Mobius in misoprostol. Cutis laxa and penicillamine. Focamilia and thalidomide. And aplasia cutis congenita in metimazole. Okay? So, ang dami guys, since we're just summarizing everything, I want you to take note of those na nakabold na red. Okay? And what else? Siguro kung may dadagdag ako this one pa. Madalas tanungin sa exams. Your diethyl silvestro can cause vaginal clear cell adenocarcinoma. Okay, so that's also a commonly asked question. So remember these drugs. So ito kasi, it's not something to be explained, it's something talaga na may na-memorize. So yung ganito, dikit nyo sa wall nyo, print nyo, just memorize. Okay? Now for your autonomics, okay, mag-emphasize lang tayo ng particular drugs. So for your autonomics, ang gusto ko lang emphasize dito, you have kasi your cholinergic versus your adrenergic neurotransmitter. So cholinergic, then you also have your adrenergic. Okay? So first dun sa cholinergic, ang important dito, na-emphasize ko parate, yung which steps are targeted. So for your synthesis step, palitanda ako dito, hemi, kalahati pa lang, hindi ko pa nagagawa. Ginaya niya si acetylcholine. So hemi-choline yung synthesis phase. Anong counterpart sa adrenergic? Anong precursor amino acid ng mga adrenergic neurotransmitters? Tandaan niyo to, tatanungin ito sa biochem. Precursor amino acid ng neurotransmitters is your tyrosine. Hence, tyrosine is an inhibitor nung synthesis kasi hindi siya totoong tyrosine. So, kinokontra niya yung totoong tyrosine. Ito naman, hemicholine yung. Kasi kinokontra niya yung, di ba, acetyl-CoA plus choline. So, hindi ka makaka-form. That's your synthesis phase. Then storage, para madaling tandaan, vesicle. Vesicle is used to store. Reserve is also known as storage. So vesamicol and reserpine both target the storage. Okay, tandaan yan. Both target the storage. Difference, vesamicol is cholinergic, reserpine is adrenergic. What targets the release? Your botulinum for cholinergic. So ito yan. So inhibits the release, kaya kami flaccid paralysis. Guanethidine inhibits your adrenergic release. And then in terms of termination, ibig sabihin, mawawala yung effect. Bakit? So either i-metabolize mo siya because of the enzyme what? Acetylcholinesterase. Again, acetylcholinesterase is the enzyme that degrades acetylcholine, targeted by your several drugs, including your stigmine, your neostigmine. And then your other inhibitors of metabolism are MAOI and your COMT, or your MAO inhibitors and catecholamine O-methyltransferase, which are adrenergic drugs targeting the metabolism. Why? Ano nga? Enzyme ito tinatarget sa acetylcholinesterase. Ito rin. Monoamine oxidase, tsaka catecholamine O-methyltransferase. Okay, yun yung mga tinatarget na enzymes. And then lastly, your cocaine. Your cocaine targets the uptake. So ito yan. Cocaine plus, okay. So memorize nyo to. Cocaine and TCA. Star natin yan. Pag sinor ko, sabihin, dadaanan, ulit, dadaanan, days, weeks, little time before the burst. Kailangan alam niyo yung mga nakastar. Your cocaine and TCA inhibit the reuptake of your norepinephrine or your adrenergic neurotransmitters. Okay? Cocaine and TCA. Okay. Ngayon, gusto ko lang i-emphasize tong table na to kasi gusto ko maintindihan nyo maigi. Pag sinabing mimetic, same. Pag lytic, different. So, itong mga parasympathomimetics, yung mga ang action ay parasympathetic. Yun yung mga cholinomimetics, agonist, muscarinic nicotinic agonist, or kabaliktaran kapag lytic. So, then adrenergic alpha itong magkaanak kasi balit, no? Then ang manings para sympathomimetic ay dumbbells. Okay, so ito memorize nyo na lang to from your handouts. In short, pag para sympathomimetic, digest. See, rest and digest. So sympathomimetic, just the opposite. Di na natin isa-isahin. But ano mo tatandaan? Si Alice in Wonderland. Again, ulit-ulit. Muscarinic effects, dumbbells, rest and digest. Anti-muscarinic effects, your Alice in Wonderland symptoms. Hot as a hair, dry as a bone, red as a beet, blind as a bat, and mad as a hatter. Okay. Okay, so tinanong sa recent boards, atropine side effects except, so ano yung hindi side effect ng atropine? Ano kaya? So sagutan ko na since dahil pa natin di-discuss. That's your diarrhea. Okay, bakit? Side effect ang diarrhea? Hindi. Yun ang isa sa opposite or sa use niya. Kasi your diarrhea is part of your dumbbells, which is again dumbbells. Muscarinic. What's atropine? anti-muscarinic. Okay? So, itong B to D, tama yan. These are side effects, di ba? So, common drugs lang na para sa pathomimetics, emphasize ko lang, no? Yung uses nila. Yung mga col. Botanicol, carbacol, these are used for your bowel and bladder atomy. Okay, your bowel and bladder atomy. Pilocarpine, used for your glaucoma. So at this point, medyo nabasa nyo na, so refresh lang tayo. Nicotine and varenicline for smoking cessation, difference. Full C nicotine, partial C varenicline. How about your succinylcholine? It's again, sinabi natin kanina, depolarizing. Contract muna bago relax. Hydrophonium versus your carbamates. So versus your stigmine. So these are all acetylcholinesterase inhibitor. Okay, they all inhibit the degradation of the enzyme. In terms of use, the hydrophonium, diagnosis. Carbamates, treatment, especially your neostigmine. Physostigmine, atropine, toxicity. Organophosphates like your, malathion, parathion, may mga thion. So having a thion in the compound, having a thion, allows them to have covalent bonds. Tandaan nyo to, pag covalent bond, permanent, matagal, irreversible yung gamot. Okay? Permanent, matagal, irreversible yung effect ng gamot. So, may insecticide toxicity. And then lastly, ito hindi tinatanong masyado, airway nerve gases. So, antidotes natin for organophosphate poisoning are your atropine versus your pralidoxime. So, your atropine, again, ulit-ulit tayo, is an antimuscarinic. Your pralidoxime naman, ito yung emphasize ko, it addresses both nicotinic and muscarinic symptoms ng organophosphate poisoning. Bakit? Because your pralidoxime regenerates your cholinesterase. How? Si organophosphate ay acetylcholinesterase inhibitor. Again, acetylcholinesterase inhibitor. Si pralidoxime ay acetylcholinesterase regenerator. Bakit? Anong gagawin niya? Si pralidoxime acts as a chemical antagonist. How? It will bind, kakapit siya dun sa phosphate ng organophosphate, para hindi na siya makakapit kay acetylcholinesterase. So, mangyari, na-regenerate sa acetylcholinesterase. Siya na lang natira. Hence, na-treat yung toxicity. What's good about pralidoxime? It addresses both nicotinic and muscarinic symptoms. Why? Dito, it's an anti-muscarinic. So, muscarinic receptor lang kasi yung pharmacologic antagonism na involved. Dito, kay pralidoxime, both nicotinic and muscarinic kasi your pralidoxime regenerates acetylcholinesterase. So, wala akong pake kung sa muscarinic ka kumapit or nicotinic. Ang mahalaga, free up ko si enzyme, si acetylcholinesterase. Okay? I hope that made you understand. So, ito, na-discuss na natin itong pneumonia kanina, no? So, skip na natin yan. So, ito, parasympathetics, emphasize ko lang. We have your zepins. So, tandaan nyo, yung dalawang zepin are for peptic diseases. Although usually, peptic acid disease, what do we use? Your proton pump inhibitors, your H2 blockers. Okay, or also your antacids. But first line, proton pump inhibitors, like your omeprazole, pantoprazole, esomeprazole. For your phenacin, tsaka oxybutynin, not that common na drugs. You just have to know the, the uses kasi tinatanong pa rin yan sa boards. You have your urinary urgency and urinary incontinence. Bakit? Para sympatholytic to. So, ibig sabihin, imbis na rest and digest, kabaliktaran. So, hindi ka iihi. Therefore, kung ihi ka ng ihi, pwede mo itong gamitin. Your diphenacin and oxybutynin kasi it will stop the urine flow. Okay, so urinary retention, di ba yung side effects? So, sabihin, contains the urine. Your atropine, we already discussed this. So, ito madalas tanongin your hexametonium tsaka your trimethophan. They are NN, nicotinic neuronal or your ganglionic blockers. Okay, your ganglionic blockers. And as you mentioned, your curares are neuromuscular blockers. Okay, your neuromuscular blockers acting as, neuromuscular blocker. So, skeletal muscle relaxant. Okay? So, your sympathomimetics naman na important, we have your norepinephrine, drug of choice for septic shock. Okay? Septic shock. Pag anaphylaxis or anaphylactic shock, epinephrine. Bakit nga, Doc? Tinuro ka na kanina. It's a physiologic antagonist of your histamine. Si epinephrine, bronchodilation and vasoconstriction. Kabaliktaran ng effects ng epinephrine. Dopamine, ang tandaan nyo, is renal failure. Drug of choice for shock, any type of shock with renal failure. Why? Your dopamine increases your RBF, also known as your renal blood flow. Okay, isa sa effects ng dopamine yun. It increases your renal blood flow. Next, your phenylephrine and oxymetazoline, these are your decongestants. How? They're alpha-1 agonists. Alpha-1 agonist, ibig sabihin, they constrict. Ano ba kapag sipon? Dilated. Kaya sinispon. So, to decongest you, constrict. So, use an alpha-1 agonist. Clonidine can cause your rebound hypertension. Clonidine and methyldopa are alpha-2 agonists. Okay? So, tinatanong din yan. Anong favorite tanongin kay methyldopa, Doc? Side effects. So, tandaan niyo to. For clonidine methyldopa, ito yung pwedeng tanungan. Rebound hypertension and sedation tsaka hemolytic anemia. Okay? Sa methyldopas or positive Gun's test. The butamine, again, sabi natin kanina, tachyphylaxis. Ano pa? Eosinophilic myocarditis. Okay, eosinophilic myocarditis. It is also used as one of the drugs of choice for cardiogenic shock. So, anaphylactic, epinephrine. Septic, norepinephrine. Cardiogenic, the butamine. It's also component of your cardiac stress test. Then lastly, ito, ano to mga to guys? These are, kung nabasa nyo, beta-2 agonists. So, these act as tocolytics or prevent premature labor. Then, lastly, no, you have your Fe. So, tandaan nyo, Fe. Phenoxybenzamine, pheochromocytoma, phentolamine, pheochromocytoma. Difference? Phenoxybenzamine, mahaba. Ito yung irreversible. Phentolamine, maikli. Ito yung reversible. Both are alpha-1 alpha blockers. Okay? Alpha blockers. And then your azosine or sulocine, these are your drugs for anong sakit guys? Na counter nyo sa patients, no? Your BPH. What to remember? Your adverse effects of first dose phenomenon or orthostatic hypotension. Okay, remember that. And then ano pa? In terms of selectivity guys, to, sa mga blockers na to, alpha-1 blocker. Okay, alpha-1. Hindi siya non-selective. Ang non-selective alpha blockers are your Fefe, and then yung mga selective are your zosine. Alpha-1 blockers. Okay? So your beta blockers include the following. Emphasize ko na lang, no? Since this is summary lecture. Small as half-life. Nadolol, nasa dolo ang half-life. Then palatandaan ko dyan. Carve the label. So carve the label kasi your carvedilol and labetalol have alpha and beta blockade. So special sila kasi they block both alpha and beta. And then your nebivolol, paano tandaan? N for nitric oxide and B for nebivolol, BI for beta 1. Okay, so nebivolol causes nitric oxide release and beta 1 blockade. Okay, so beta 1 tsaka nitric oxide. Again, nitric oxide tsaka beta 1 mechanisms ng nebivolol. Then si carvedilol, labetalol, alpha and beta. So inisip ko dyan para kang nagka-carb, di ba? Alpha, sipin nyo na lang. Tsaka beta. So carb the label. Okay. So next, CV drugs na tayo. So gusto ko tandaan nyo dito sa CV drugs, yung diuretics natin, particularly these examples. So your acetazolamide mechanism, carbonic anhydrase inhibitor. Saan location, Doc? Proximal convoluted tubule. Your semide, your bumetanide, so medyo na iba, no? And your ethaclinic acid are loop, acting on the loop of Henle. So remember, ang gusto ko tandaan nyo, ethaclinic acid. Iba itsura, iba pangalan. It is the loop of choice for those with sulfa allergy. Bakit? Magkakamuka itong tatlo, they have sulfur component, but your ethaclinic acid is not a sulfa drug. Hence, it can be given to patients with sulfa allergy. Okay? Patients with sulfa allergy. Okay, wala siyang sulfur. Your thiazides, your hydrochlorothiazide, chlorothalidone. So these are thiaziduretics acting on the DCT. So TZD acts on your DCT. Palatandaan ko for that. And then yung spironolactone is an aldosterone antagonist, while your Eplerenone is an ENaC inhibitor, which are acting on the collecting ducts. Okay, remember these mechanisms at least, no? And also your, spironolactone and eplerenone, spironolactone and eplerenone are aldosterone antagonists, while your ENaC inhibitors are amilorine and triantherine. Okay, amiloride and triantherine. So, amiloride and triantherine ENaC inhibitors. So, ito, mnemonic ko dito, no, na-share ko nito sa mga naturuan ko before. Your na bakla ka. So, mnemonic sa antiarrhythmics, na bakla ka. Sodium, beta, potassium, and calcium channel blockers. So, for antiarrhythmics naman, di ba, na bakla ka, class 1, class 2, class 3, class 4. Under class 1, so these are all sodium channel blockers. You have your A, B, and C. Mnemonic. So, kung di pa kayo nag-dinner, no, gutumin sana kayo sa burger na to. So, double quarter pounder, fengeng, lettuce mayo, tomato, kasi phenytoin. Dami kasing P eh, para madaling tandaan. Engeng, so NK9, more fries, papo. So, yung papo is propafin. What else? Tandaan, effects on action potential duration. Class 1A, A4, akyat. Class 1B, B4, baba ang action potential duration. Class 1C, C, constant ang action potential duration. Okay, so yung mechanisms nila in terms of acting on your action potential duration. So, please guys, remember this mnemonic kasi pwede siya matanong. Okay, so doon naman tayo sa drugs for dyslipidemia na tatanong sa boards. Pag tinanong, drug of choice for hypercholesterolemia, answer, your statins. So, cholesterol. Paano naman kung resins? Ang resins natin, your these are bile acid resins, kailangan tandaan your adverse effects, your steatorrhea and malabsorption. For your ezetimibe, or your NPC1L1 transporter inhibitor, have liver. Okay? Liver toxicity. Your statins can also cause liver and muscle toxicity. Remember that. Okay? Statins, liver, and muscle. Your sitosterol is a cholesterol analog. Your niacin, okay, natanong din to. Increases HDL. So pag tinanong sa boards, anong bibigay sa may low HDL? Answer, niacin. Okay? Your niacin. So, ang common side effect ng niacin is flushing, wherein you should give what treatment? Your flushing. Again, for niacin causing flushing, you give your aspirin. Okay, aspirin for the flushing caused by niacin. Then lastly, your fibrates activate your PPAR alpha. PPAR alpha. So it is a drug of choice for hypertriglyceridemia. Recap. Pag cholesterol mataas, gamot, statin. Pag HDL mababa, gamot, niacin. Pag triglycerides ay mataas, gamot, fibrates. Okay? So remember these basic concepts. So let's move to the drugs acting on smooth muscles. Gusto ko lang emphasize here. So your buspirone, so mnemonic tayo, no? Buspirone, parang 1. So 1A, buspirone, partial agonist. Ito, triptan, ako palatandaan ko dito, yung one direction, so 1D, tuka-trip, tapos nagka-migraine sa trip. So, one direction, nagka-migraine sa trip. So, sumatriptan is a drug of choice for migraine. And in terms of mechanism, serotonin 1D agonist. Okay, sumatriptan, trip, yung one direction daw. So, 1D. Then yung serotonin 2A, your ergot compounds, mnemonic, ergotumine. Then serotonin 3, setron. So, tron, 3. Cetrons. Okay, use ng cetrons, your chemotherapy-induced nausea and vomiting. Again, ito migraine. Ito chemo-induced nausea and vomiting. Then lastly, palatandaan ko dito. So, sa dulo na. Tingnan nyo. So, yung nasa dulo, tagasunod. Okay, so, tagaserod, tagasunod. Okay, so siya yung serotonin 4. Siya yung sa dulo. Okay, so your prostaglandins, ito na-discuss na natin earlier. Hindi ko na-expound now. Okay, so these are discussed in your quizmaster. So drugs for cough, ito natatanong din sa boards. In terms of mechanism, pag may cysteine, Sa biochem, no, cysteine has a thiol. Your thiol has an SH, sulfur with hydrogen. Your SH would break the disulfide bridges na nagfo-form or nagpapakapal ng plema. Okay, that's why it's called mucolytic. It lyses the mucus. Your guaifenesin irritates your gastric vagal receptors, expectorating the phlegm. Your opioids are centrally acting, di ba? They're antitussive, so pang dry cough. So mechanism, decrease sensitivity of CNS cough center. Si butamirate, centrally acting pa din sa brain stem receptor. Si levodopropisin naman, peripherally acting. So memorize nyo to kasi siya lang yung peripherally acting na antitussive. And then last year, Lagundi is mainly a bronchodilator. Meron ding anti-inflammatory properties to, but mainly it's a bronchodilator. So remember these mechanisms of action. Again, we try to simplify it, no? Pero tinatanong yan sa boards talaga. So, ito, your ketotifen was as in the one of the recent boards. So it acts as a non-competitive antihistamine and mast cell stabilizer. Okay, so remember that. So antihistamine na siya, mast cell stabilizer pa siya. Sino yung makilala ng mast cell stabilizer? Your cromolyn. So nedocromyl tsaka cromolyn. Okay, those are your mast cell stabilizers. So briefly, let's discuss your CNS drugs. So mnemonic natin dito for barbiturates para malaman yung duration of action. So may TH, no? Thiopental, methoxetal, ultra short. Then yung long acting, yung may PH. So pilit, pero madali siyang tandaan. So PH. Tapos Primadonna, kaya matagal mag-ready. So si Primidone, long acting. So let's continue, no? So for this one, you have to remember, so we talked about your barbiturates, no? So yung for this one, ako nung dito, ito succinate. So sucs, so para siyang sucks. So sucks milk. So mechanism of action na is sa calcium channel. So that's your ethosuximide. How about clomazepine and phenytoin? So ito, inisip ko, these are the anti-seizure meds acting on sodium channels yung tatlo. So if you want a crazy corny mnemonic to, ba't ka nanginginig? So seizures, naka-bili, ano ba, ng coffee. So naka-bili, so your sodium channels, valproate, your carbamazepine, and your phenytoin. Okay? Or tandaan nyo na lang yung tatlo. And one more thing about valproate na gusto ko i-emphasize, your valproate is one of the anticonvulsants na CYP450 inhibitor. Okay? Kasi most of these, like your carbamazepine, your phenytoin, and your phenobarbital, these are all CYP450 inducers. Okay? So please guys, huwag niyong kakalimutan. Valproate is an inhibitor. Okay. So ito, no? Kita-kita na yung natakpan. So, all local anesthetics are vasodilators except your cocaine. The most cardiotoxic of all local anesthetics is your bupivacaine. Associated with methemoglobinemia is your benzocaine or your prilocaine. And the antiarrhythmic used for digitalis toxicity is your lidocaine. So ito, please remember nyo to. Again, this is summary lecture. This is not all about local anesthetics, but I hope it makes you remember. Okay? So, okay, again, constrictor, cocaine, constrictor. The rest, dilator. Most cardiotoxic, bupivacaine, methemoglobinemia, benzocaine, and prilocaine. And antiarrhythmic for digitalis toxicity is your lidocaine. Okay? Again, kung titignan nyo kanina, no, your lidocaine is what class of antiarrhythmic? Class 1. Ano kaya? Nalala nyo ba? So, double quarter powder, penging, lettuce. So, lidocaine is your lettuce. Class 1B. As a class 1, ano po? Anong mechanism? Nabakla ka. So nabakla ka. So, sodium. So, this one naman, so for your antipsychotics, you have your typical or classical versus your atypical. So, your typical antipsychotics, kaya siya typical kasi ito ni addresses your positive symptoms like your hallucination. it blocks more of your D2. Kaya siya typical. Kasi bakit? Nung na-invento yung atypical antipsychotics, mas nag-target ka na ng serotonin 2A receptors, therefore also reducing your negative symptoms. Okay, remember this. In terms of potency, pag high potency, high, haloperidol. Pag low potency, your thioridazine and your chlorpromazine. So remember this. So guys, yung sinasabi ko, prototypes naman, hindi lang ito yung drugs. So again, I'm just summarizing. So you should still check your handouts for the complete list. Pero ito yung mga common na prototype na drugs na nababanggit. So yun, gusto ko tandaan niyo. Pag sabing high potency, ibig sabihin the higher D2 blockade. Higher D2 blockade. So therefore, anong sabi natin? Pag low dopamine, Parkinson's. Diba? Pag high dopamine, ano naman? Psychosis. So tandaan niyo yan. So therefore, if you're treating psychosis, you want to address this, diba? Bababaan mo si dopamine. Ano makukuha mong symptoms? Parkinson's-like. Or it can manifest as your extrapyramidal symptoms. So therefore, the more you block D2 in your typical, the more EPS you have. Okay, so high potency, more EPS. How about your low potency? So your low potency, okay na, hindi masyadong D2 blockade. Ang problem, may anti-HAM effect. So remember nyo ito. Anti-HAM, meaning antihistamine, kaya inaantok, sedation. Alpha, so nangyari sa alpha blockade, baba ang BP, hypotension. Muscarinic blockade is magkakaroon ka ng anti-muscarinic. So, pwede magkakaroon ng Alzheimer's symptoms. Particularly dito, pwede magkaroon ng dry eyes or dry mouth. So, anti-muscarinic. How about your atypical naman? So, dahil typical, atypical naman, addresses both positive and negative symptoms. So, ito yung mga mas bago. You have your zapin with the highest weight gain. So, palatandaan, hindi kumain ng sapin-sapin. Kaya, tumataba. So, weight gain. Your risperidone is the only antipsychotic approved for youth na may schizophrenia. So, only anti-schizophrenic drug for children. Also in Nelson. So, mas no. And the others are the following. Okay? So, ang important tandaan kapag atypical antipsychotics, metabolic yung adverse effect. Again, ulit-ulitin, pag high potency typical, EPS. Pag low potency atypical, ay low potency typical, anti-HAM. Sorry, ang baboy ng drawing natin, no? Then kapag atypical, yes, metabolic. Okay, metabolic like weight gain and endocrine problems. So for your opioids naman, remember these, no? So gusto ko na lang i-emphasize, aside from these na nasa handouts nyo, are the opioid overdose trial. So CPR yung isang pwedeng mnemonic, diba? So pag na-overdose ng morphine, anong gagawin mo? Mag-CPR ka. So what's your CPR? Comatose, pupillary constriction, or meiosis, diba? And respiratory depression. So remember that. Mag-CPR. Okay. You tried opioid overdose. So mnemonic natin for lethal injection, no? Kung nakita nyo na to. So papatayin kita. So pancuronium, you have your pancuronium, your potassium chloride, and your thiopental. Ayun kita. Okay? So yun mnemonic natin. So ewan ko kung makakatulong siya sa inyo, pero it helped me. So drugs for hema naman, so gusto ko ng important emphasize, no? Prototype natin na antiplatelet, your aspirin, is a non-selective and irreversible COX inhibitor. So hindi ma-reverse, hindi selective. Ito, abciximab, tirofiban, aptifibatep, diba? Na-emphasize na tinagok in sa inyo, yung mnemonic na may 2-3 pack abs yung mga taga-FIBA. Okay, may 2-3 pack abs yung mga taga-FIBA. So 2-3 pack abs yung taga-FIBA. Then itong mga may cloth tsaka grel. So tandaan nyo lang si clopidogrel. Lahat yan, ADP. Again, pag may cloth, like your ticlopidine, or may grel, like your prasugrel, ticagrelor, these are ADP inhibitors. Then pag PDE3 inhibitors ng antiplatelets, you have your
silostazole, and dipyridamole. Okay? So ito yung mnemonic ni document for that. Pwede mo matay sa silong mga 3 times daw. So PDE3, momol, dipyridamole, silong is silostazole. Okay? So anticoagulants, again, na-discuss natin kanina si warfarin. So ito naman mga saban. Ibaroksaban, apixaban, mga ganyan, may sa. Tapos ban, ibig sabihin mo. Ban is antagonize. Tapos XA. So mechanism, factor 10A inhibitor. Again, factor 10A inhibitor. So saban. Advantage, it is a rapid and shorter half-life than warfarin. How about your heparin? Ito ang drug of choice again for pregnant. Kung monitoring ng warfarin is ano nga, within time, antidote, vitamin K, or fresh frozen plasma. Ano naman kay heparin? So sa kanya yung APTT, and ang antidote natin is your base na discuss natin. Then quickly, ito mga saccharin, parin. These are antithrombin 3 potentiator. Okay, so the advanced potentiator effect of antithrombin 3 as with your heparin. So these are your low molecular weight heparin. Difference, hindi mo monitor sa APTT. Then, ito naman. Ano yung antidote to the bigatran? That is your idarucizumab, diba? Idarucizumab. Okay? So, again, memorize nyo itong mga antidotes. Okay? What else na memorize? Mga indications na unique. So, again, high molecular heparin for your pregnant patients. So, dun na tayo sa other drugs and kids, DMARDs. So, since short na tayo sa time, ma-emphasize ko lang, first choice nyo for rheumatoid arthritis is your DMARD na methotrexate. Again, na-discuss kanina, so ulit-ulit tayo kasi important. Polinic or lucoporin yung antidote. Okay, so the others you memorize, but I want to share this mnemonic, no? So, I'm thankful. So, TNF. To Sir Ethan. So, si Ethan Hawke, di ba? Yung sa picture. May limona, may Netflix pa. Okay, so remember this mnemonic. Meaning, TNF-alpha inhibitors, Sir Ethan. May limona, may Netflix pa. So, yung isa is in fixing. Okay? So, siguro corny na kayo. Okay lang guys, ilang minutes na lang. So, I'm thankful to Sir Ethan, may limona, may Netflix pa. These are your TNF-alpha inhibitors. Must know. Okay. Other drugs, monoclonal antibodies. So, paano mo na-memorize? Pinumab, Ventin, Siliximab. 2 ulit, so B. Second letter. Uste. So, I think pinamalik ng document here is parang yung paskuhan daw ng uste sa December, no? 23. So, mas maganda yata yun kasi yung akin ng corny, parang 1, 2, 2, 3, go! Uste. So, ganun yung mnemonic ko for this. Parang yung cheer. Asa tomasya, no? So, 1, 2, 2, 3, or pwede rin, yan, maganda rin yung December 23 or 12, 23. So, basta tandaan nyo, target na interleukins. So, ito, tandaan nyo, these are the drugs affecting microtubules. Pero aside from knowing that, pakita ko na lang yung mnemonic, no? Para mas madali nyo matandaan. So, maliit ang tubo if mag-grab to Cavite. So, ano yung drugs acting on your microtubules? So, para madaling tandaan, microtubules, maliit ang tubo. So, nga naman. So, isipin mo, galing ka kunyari ng Manila, kung mag-grab ka ng Cavite, di ang mahal nun. Tapos, may tindahan dala. So, tubo maliit. So, maliit ang tubo if mag-grab to Cavite. So, Primebendazole, thiabendazole, these are anti-helminthics, diba kanina? Busulfan, antifungal. Colchicine, so for gout, no? Albendazole, also antifungal. Then, your Vinca and Taxane are chemo. So, tignan nyo. Antifungal. Okay, so these 3 are antifungal. These 4 are antifungals. These 2 are anthelmintics. This is an antifungal. And this is an anthelmintics. What I mean is these 4 are antibiotics. Okay? Then your colchicine is for gout. Then your vinca and toxins are chemo drugs. Okay, so endocrine na tayo, more important na. So yung drugs with amino acids in their name, yung mnemonic ko dyan, lysine and choline, aspartate, glutamic and lysine, these are rapid-acting insulin. So mabilis, may amino acid, basic drugs lang. Then your regular is the short-acting. Ito, memorize ko na lang sa NPH at lengthier intermediate. Then ito, ultra, large, dati pa. So, Betty. Then glued, these are long-acting. Okay, so tandaan niyo yung mga naman. Ultra, large, dati, glued. So, glued, di ba parang nakadikit? These are long-acting insulins. So, ito, na-discuss na natin earlier. So, drugs for diabetes. So, this one, I won't discuss na, no? Basta remember niyo, mas important itong side effects. Okay, now we proceed to your antibiotics. So, gusto ko lang emphasize yung most common side effects. So, for your penicillin, whatever the penicillin, sasagot nyo, hypersensitivity and GI upset. Again, hypersensitivity and your GI upset. Again, hypersensitivity and GI upset. Yung disulfiram reaction, na-discuss ko na kanina, no? I met a man who procured and fought for money and died soon, di ba? And then ito, I want to emphasize, so start na to sa notes. Pag sinabing methicillin, na-discontinue to dahil it can cause your interstitial nephritis. Again, your interstitial nephritis. And then your nafcillin, letter N, neutropenia. Ito, na-discuss na rin natin your ampicillin clindamycin causing your pseudomembranous colitis. Then your Redman syndrome can be caused by your vancomycin pneumonic. Ang palatandaan ko dito, dala-dala yung red band. So, vancomycin acts on your D-ala, doon siya nagbabind. So, dala-dala yung red band. Then, again, grade baby, di ba? Alam niyo na yun, aplastic anemia. So, sa chloramphenicol. For QT prolongation, marami, including your quinolones and macrolides. Then, lastly, your quinapristine, dalfopristin, tinandaan ko pareho silang magkadikit. So, quinapristine, tapos dalfopristin, this is the main causes, magkadikit din. Arthralgia, tsaka myalgia. Okay, so na-discuss na natin itong pneumonia. Doc, I think pala we have less than 10 minutes, so if ever mag-protocol ko, Doc, si Doc Yali.
Okay na.
Anyway, so this one we discussed earlier. Thank you, Doc. So, okay, so ito, gusto ka emphasize, drug of choice for sexually transmitted infections. So kahit anong kahit anong subject, basta micro or STI, tatanungin mo sa boards. Again, tatanungin mo sa boards. So pwede sa IM, OB, pedia, not naman siguro pedia, pero micro, pharma, they usually ask for sexually transmitted infection. So drug of choice for syphilis is your penicillin G, for gonorrhea, ceftriaxone, chlamydia, doxy or azithral, candidiasis, your mistapine, and your azoles. In your backbat, your bacterial vaginosis, your metronidazole. So please know this by heart. Again, know this by heart. Cephalosporins of choice. Pag Pseudomonas, you choose these three. Kung pipili ng isa, si ceftazidime. Pag Neisseria, again, gonorrhea yun, kanina, ceftriaxone. MRSA na cephalosporin, your ceftaroline, or sa ibang reference, it is your 5th gen cephalosporin. Pag pneumonia or strep pneumonia, ceftriaxone and cefotaxime. And then, anong ginagamit nyo sa ward? Di ba pre-op, your cefazoline, this is your 1st gen. Ginagamit siya as prophylaxis, di ba? Pre-op prophylaxis. Drugs for HIV, so emphasize ko lang yung mnemonics. Paano tandaan do? Pag may veer sa gitna, ano siya? Yung dalawang N, may N din sa gitna. So, NNRTIs, may veer sa gitna. Next, your protease inhibitors. So, tandaan ko dito, PI na virgin. So, PI na virgin. So, protease inhibitors, na veer. Your fusion inhibitors, flubertine. So, magsi-CR daw si Mara. So, CCR5. Then, Tegra. So, integrase, dolutegravir, daltegravir. Okay, these are drugs for HIV. Okay. So ito, mnemonic to since nung pharma kami, no, yung Mager pens, paano siya ina-analyze. So, sulat nyo lang kapag sa boards, Mager pens, West, Gabiansa, East, Odysseansa. Tapos tandaan nyo, yung gitna, CNS face, gilid, blood face. Then, mahirap kasi yung names ng gamot, diba? Kasi hindi siya common. So, tandaan nyo na lang yung Mager pens. So, pag West African is caused by Gambiense, so that the drugs could either be pentamidine for your blood phase, eflornithine for your CNS phase. Pag East African sleeping sickness, melarsoprol for your CNS phase, suramine for your blood phase. Okay? Basta tandaan niyo yung mnemonic na other PEMS. Until matrix of choice, I discussed earlier. And then lastly, second to the last, diniscuss na rin natin kanina, no? During your Quizmasters, yung mechanisms on the cell cycle. Okay. So, ito, start tayo dito. Kung magtatanong ng isang drug sa chemo, kung hindi mechanism, I feel like adverse effect siya. In the recent trend sa boards talaga, adverse effect. So, tandaan mo, platins, nephrotoxic. Okay? So, drawing nyo na lang to. So, cisplatin, vincristine, ito yung V, peripheral neuropathy. Doxorubicin, heart. So, cardiotoxic, bleomycin, B. B for baga. Or drawing niyo yan. So, bleomycin. Then, cyclophosphamide, CY. Hemorrhagic, cystitis. Then, ito, lahat to, diba, itong B, vincristine pa rin, Pervinca. Then, itong 56 tapos may M, these are your drugs causing myelo suppression. Okay? So, remember the chemo. Again, the rescue agents discussed earlier. Mechanisms of actions. Now, for GI drugs, so gusto ko lang tandaan yung laxatives na mechanisms. So, commonly, ina-ask yung naka-red. Okay, so remember that. Balikan nyo na lang. And then for your toxicology, just remember the antidotes. So, what I want to emphasize lang dun sa tables na meron din kayo sa handouts are the following. So, for your benzodiazepine toxicity, we use your aze. Benzodiazepine, fluazepine. For again, omeprazole na discuss natin, alcohol dehydrogenase inhibitor. So alcohol toxicity, methanol, ethylene glycol, and ethanol. Your naloxone, again, is an opioid antagonist, so opioid poisoning. Pyridoxine, again, for your organophosphate toxicity. Mechanism ulit to, acetylcholinesterase regenerators. So, kung napapansin nyo sa antidote, ang dami na natin discuss kanina, di ba? Kasi it's a commonly asked question in the boards. And aside from antidotes, of course, remember the adverse effects. So, yun ang recent.